Podcast 1 of the Thorax series, Osteology of the Thorax. This podcast will detail the bones and articulations of the thoracic cage. So the thorax is an osteocartilaginous cage that is formed from both bone and cartilage and serves to protect the thoracic viscera like the heart and lungs, and it also aids in respiration. The thoracic cage is also involved in protecting the abdominal viscera like the liver and spleen that project into the thorax and sit underneath the diaphragm. So the thoracic cage is formed by 12 thoracic vertebrae posteriorly, 12 pairs of ribs laterally, and the sternum anteriorly. So let's detail the main features of the thoracic vertebra, the ribs and the sternum. Each of the 12 thoracic vertebrae of the vertebral column all share the same common features. They all have a large, heart-shaped vertebral body anteriorly and a posteriorly facing vertebral arch. The vertebral arch is formed by 2 pairs of bones, the pedicles and the lamina. The 2 lamina form the posterior aspect of the vertebral arch, whilst the 2 pedicles join the lamina to the vertebral body. The vertebral arch and the vertebral body together form the vertebral foramen, and this is circular in shape and contains the spinal cord, the 3 layers of meninges and cerebrospinal fluid. Associated with the vertebral arches of each thoracic vertebra are 7 bony projections. There is the spinous process, the paired transverse processes, and the 2 pairs of articular processes, the superior and the inferior. So let's detail these features of the thoracic vertebra. So the spinous process of each thoracic vertebra is long and slender, and they extend posto-inferiorly from the vertebral arch at the junction of the lamina and overlap the vertebral arch of the inferior vertebra. On either side of the vertebral arch, the transverse process projects laterally from the junction between the pedicles and the lamina, and each transverse process contains the transverse costal facet, which allows articulation with the tubercle of a rib. Also projecting from the junction between the lamina and the pedicle are the 4 articular processes, which are involved in joining the adjacent superior and inferior vertebra. Each vertebra has 2 superior and 2 inferior articular processes, which, as their name suggests, project superiorly and inferiorly. These articulations join the superior and inferiorly corresponding vertebra and increase the stability of the vertebral column. So let's describe the interaction between these processes, and to do this, let's describe the interaction between the 6th, the 7th and the 8th thoracic vertebra. So the 2 superior articular processes of the 7th vertebra are going to articulate with the 2 inferior articular processes of the 6th vertebra, whilst the 2 inferior articular processes of the 7th vertebra are going to articulate with the 2 superior articular processes of the 8th vertebra. So to go over that again, the superior articular facets of the vertebra below articulate with the inferior articular facets of the vertebra above. You should remember that this arrangement is going to exist for all the cervical, thoracic and lumbar vertebra, with the sacral and coccygeal vertebra being fused. So to finish detailing the features of the thoracic vertebra, then if we return to the vertebral body, then there are 2 facets on each side of the vertebral body, and these are for articulation with the head of a rib. These are known as demifacets, with each vertebra having 2 superior and 2 inferior demifacets. So in summary, each thoracic vertebra has a vertebral body which is heart-shaped and contains a pair of superior and a pair of inferior demifacets. There is a posteriorly facing vertebral arch, which is formed by a pair of pedicles and lamina, a spinous process that projects posto-inferiorly from the junction of the 2 lamina. Then finally, at the junction of the lamina and pedicles, there is a pair of superior and inferior articular facets which join corresponding vertebrae, and 2 transverse processes that extend laterally to articulate with the ribs. So now let's turn to the ribs of the thoracic cage. The 12 pairs of ribs form the bulk of the thoracic wall by forming parts of the posterior, anterior, and all of the lateral walls. Each of the 12 pairs are roughly flat and C-shaped, but there are also large variations found between them. And because of this, the ribs can be divided into either true, false, or floating ribs, depending on how they attach to the sternum. The first 7 ribs are known as true or vertebrocostal ribs, as these directly attach to the sternum via their costal cartilages. The next 3, so that's the 8th, 9th, and 10th ribs, are known as false or vertebrochondral ribs, as they attach to the sternum indirectly by extending their costal cartilage to the costal cartilage of the rib above. The final, most inferior 2 ribs, so that's the 11th and 12th, are much shorter, and these do not extend to the sternum as they finish embedded within the musculature of the posterior abdominal wall. Because of this, they are referred to as floating ribs. So let's describe the main features of the ribs. Now, to do this, the ribs can be described as being either typical or atypical, and out of the 12 ribs, the first and second, and then the 10th, 11th, and 12th are considered to be atypical, with the remaining 7, so that's the 3rd to 9th, considered typical. So let's start by detailing these typical ribs. Each of these typical ribs is going to have a head, a neck, a tubercle, an angle, a costal groove, and a body or a shaft. So the head of the ribs contains 2 articular facets for articulation with 2 vertebral bodies. Then extending from the head is the neck of the rib, and this connects the rib's head with the rib's shaft or body. At the junction of the neck and the body is the rib's tubercle, and this contains a facet for articulation with the transverse process of a vertebra. From this tubercle is the rib's shaft, which turns anteriorly at the costal angle, and then extends medially to attach to the sternum via the costal cartilage. The final feature of the rib is the costal groove, and this runs along the inferior border of each of the ribs. And this groove is important as it offers protection for the intercostal nerve and vessels which are running around the thoracic wall to supply the contents of the intercostal spaces. So in summary, each of the typical ribs, which are the 3rd to 9th, has a head, a neck, a tubercle, an angle, and a body or a shaft, with the costal groove running along the inferior border of the body. The head of the rib contains 2 facets for articulation with the vertebral bodies, and the tubercle contains a facet for articulation with the transverse process of a vertebra. So this then leaves the remaining 5 atypical ribs, which are the 1st and 2nd, and the 10th, 11th, and 12th. The first rib is the shortest and widest of the 12 ribs. Its head contains a single facet for articulation with the first thoracic vertebra, and its superior surface contains a ridge which separates 2 transversely orientated grooves. This ridge is the scalene tubercle and is the attachment site for the scalene anterior muscle. In front of the scalene tubercle is a groove for the subclavian vein, and behind this tubercle is the groove for the subclavian artery. The second rib is more typical than the first, being longer and more slender. It contains 2 facets on its head for articulation with the first and second thoracic vertebra, but its most prominent atypical feature is a roughened area on its upper anterior surface, and this provides attachment for serratus anterior. The remaining 10th, 11th, and 12th atypical ribs all contain 1 facet on their heads for articulation with the corresponding vertebra. The final 2 ribs are considerably shorter, and these do not contain either a neck or a tubercle, and because of this they do not articulate with a transverse process, and they also do not attach to the sternum, and these end in the musculature of the posterior abdominal wall. So how do these ribs articulate with the thoracic vertebra? Now there are 3 articulation sites between one rib and 2 vertebrae, with the general rule being that each rib has 2 articulations with its numerically corresponding vertebra, and 1 articulation with the numerically superior vertebra. So let's work through an example using the 7th rib and the 6th and 7th thoracic vertebra. The 7th rib forms 2 articulations with the 7th vertebra, and these are between the rib's tubercle and the vertebra's transverse process, the head of the rib's inferior facet, and the vertebra's superior demifacet. The 3rd articulation is between the head of the rib's superior facet and the inferior demifacet of the 6th vertebra. So from this, you should be able to conclude that the numerically corresponding rib and vertebra have 2 articulations between the tubercle and the transverse process, and the head's inferior facet and the vertebral body's superior demifacet. The 3rd articulation is between the head of the rib's superior facet and the superior vertebra's inferior demifacet. Exceptions to this general arrangement occur at the 1st, sometimes the 10th, and usually at the 11th and 12th. These ribs only have 1 articular facet on their heads, and therefore only form articulations with their corresponding vertebra, which has a single facet on their vertebral bodies, and these are called costal facets. Also, as the 11th and 12th ribs do not have necks or tubercles, they do not therefore articulate with the transverse processes of the corresponding vertebra. This allows these ribs to exhibit a greater range of movement. The joints between the tubercles and the transverse processes are known as costo-transverse joints, and the joints between the rib's head and the vertebral bodies are known as costo-vertebral joints. All of these joints are synovial joints, with hyaline cartilage covering the articular surfaces. The movements of these joints during respiration will be detailed in the next podcast, which details the intercostal space, the diaphragm, and respiration. So finally in this podcast, let's finish with the anterior border of the thorax, which is the sternum. This unpaired bone lies in the midline or the median plane and is composed of 3 parts. Most superiorly is the manubrium, inferior to this is the body, and then most inferiorly is the xiphoid process. The manubrium forms articulations with the 2 clavicles and the 1st ribs. You can palpate your manubrium by lightly pressing your neck in the midline and working inferiorly. You should feel a bone at the bottom of your neck, and this is the manubrium, and its superior edge is known as the jugular or the suprasternal notch. Working inferiorly from here, you might be able to find a slight depression, and this is the junction between manubrium and the body, and this is known as the sternal angle. This is an important site as it's where the 2nd ribs attach to the sternum. A transverse line or horizontal line drawn across the sternal angle will be in line with the 4th thoracic vertebra, and this is known as the transverse thoracic plane. Being familiar with these bony landmarks is important, as it allows you to navigate around the thoracic wall in the living patient. Location of the sternal notch, inferiorly the sternal angle, then laterally the 2nd rib, allows you to count ribs and locate appropriate intercostal spaces. This is an important process as it allows you to position your stethoscope for auscultation, or to percuss important thoracic structures with a greater degree of accuracy. Along the lateral edge of the sternum's body are the attachment sites for the 3rd to 7th ribs that join the sternum at their sternal or distal ends by the way of costal cartilages. The 7th rib actually attaches at the junction of the body and the xiphoid process. The 8th, 9th and 10th ribs, or the false ribs, attach to the sternum indirectly by joining with the costal cartilage of the superiorly positioned rib. The xiphoid process marks the inferior limit of the thoracic cavity anteriorly, extending laterally along the line of the costal cartilage, and then posteriorly along the 11th and 12th ribs to the 12th thoracic vertebra is the costal margin, and this forms the inferior thoracic aperture. The diaphragm attaches to this inferior thoracic margin, but because of the diaphragm's two domes, it means that some of the abdominal viscera, like the liver, spleen, and parts of the stomach, are also protected by the thoracic cage. Structures that pass between the thorax and the abdomen, like the esophagus, descending aorta, or the inferior vena cava, have to pass through the inferior thoracic aperture, and this means travelling through the diaphragm. And we'll go into more details about these in the next podcast. The superior thoracic aperture is much smaller than its inferior version, and this is formed by the manubrium anteriorly, laterally by the C-shaped first ribs, and posteriorly by the first thoracic vertebra. It is kidney-shaped and allows structures to pass from the neck into the thorax, like the esophagus, the trachea, and various blood vessels and nerves. So in summary, this podcast has detailed the main features of the bony thorax, including the ribs, the vertebra, and the manubrium. In the next podcast, number 2, I'll look at the intercostal space, the diaphragm, and respiration.